One of the most rewarding things that I think everyone involved sees is that we just don't change the patient, we change their whole family. And I can't think of a better testament to the surgery than that.
We want people to live longer, but we also want them to live healthier. And so the surgery really does both. There's no question that after weight loss surgery, people will live longer because they're no longer diabetic, their high blood pressure is better. But there's also, what I would call quality of life. Can they do things? Can they play with their kids? Can they go to a baseball game? Can they get on a flight? Those little quality of life issues that really make a huge difference for patients. This surgery affects all of those things.
I was tired. I was carrying around 395 pounds, so I'd be more fatigued, less energetic, not motivated to sometimes even go to work. I was knocking on diabetes' door, went through my cardiologist as my heart was starting to get enlarged. And he says, Hector, at this rate, with your heart the way it's going, I probably give you another 10 years. Today, I'm nowhere near being diabetic, completely med-free, don't take any medicine whatsoever. Overall, I just feel great.
We tell our patients right up front that this is not an easy process, but we're going to be there 100% behind them. That the surgery is just a tool to allow them to get where they want to with their weight loss and their quality of life. Our team is comprised of dietitians, surgeons, their surgical staff, nurses, nurse practitioners, psychologists, cardiologists, primary care physicians, pulmonologists, orthopedists. The whole team really gets the patient to the surgeon for the surgery.
I have a co-worker who actually recommended Dr. Bilof, said he was one of the best in the state, if not in the country. He explained all the procedures. When he introduced the gastric sleeve to me, I would call him with questions, he would answer them, and he never hesitated on anything. Never, again, it was like, it wasn't about him, he always made it about me.
First meet with the patient, we always discuss their medical condition and what would be the best procedure for them. Here at St. Barnabas, the three main procedures that we offer for bariatric surgery are the gastric band, the gastric sleeve, and the gastric bypass. The gastric band is sort of the easiest and simplest of the surgeries we do, and it simply is a restrictive operation. The gastric sleeve is an operation where we actually remove a portion of the stomach, and which also gives the person restriction, but also will dramatically decrease their appetite. And the gastric bypass, which many patients are probably familiar with, is an operation which involves both restriction, a loss of appetite, but there's also a decreased absorption of nutrients, which is one of the reasons why that particular operation is so good for diabetes, because it appears that the decreased absorption of sugars somehow contributes to the resolution of the diabetes.
What's amazing is that I eat more now than I used to, but it's very small portion every couple hours compared to before. I might have 2 meals, but there were huge meals late at night, going to bed within the hour, not properly digesting it, turning into fat, probably storing more sugar. So it's just ridiculous, Again, if I knew what I knew now in my earlier years, I probably would have never got to this stage.
I was able to sit down with him and his family and devise a personalized program that fit his lifestyle and his social demands and what he had going on in his everyday life. And what Hector Cruz has going on in his life is going to be different from the next patient that may be on my schedule. So I feel that that's what really makes our program different, is that we just don't give our patients who are interested in surgery a standard plan of diet and exercise and go see this doctor and get this clearance. We really individualize their journey and help them stick to goals that they tell us they want to do. It's not my goals or any other multidisciplinary team that we work with. We don't give goals to the patients. We have the patients tell us what they want to change, and we work towards that goal together.
There are things that she actually went through and spoke to me about eating habits, slow carbs, fast carbs, protein, truly dividing your plate up into portions to get the proper nutrients that you need. Those are things that I never really took into account before.
Supporting the patient after surgery is very, very important, but the behavior modifications that we like to see for eating behaviors and exercise and activity patterns, we really build that into our preoperative program. It's very, very important to have successful outcomes if you modify your behavior beforehand. If the patient is trying to practice these behaviors and not having much success, we bring them in for post-operative care. And that would be with a dietitian. We have them go down to our wellness center and work with an exercise physiologist just to get back on track or to keep on track.
Everything they said, I would do it, do it, do it. And I think it's why I've had the results that I've had. My only regret was that I didn't do it sooner.
For the patient, what they can expect when they come to see us is that we're behind them 100%.
You feel great about yourself, you know, like you've accomplished something. Definitely more confident, more energetic. Don't hesitate or think twice about, you know, going out to the gym or working out. Before, you know, I would do the yard work and that would be pretty much my, you know, my exercise. Now, you know, I'll get up, go for a run, come back, cut the grass, do the weed whacking, do everything, come in, cook, do everything. It's like nonstop. So I'm grateful for Dr. Bilof and Saint Barnabas, this team that's come together and studied this and truly try to teach it to people, and you know, for the benefit of, you know, we need to be healthier, and it's not always about us, it's about those that truly depend on us.